Australia is in the grip of Omicron. Today we recorded 89 COVID deaths and more than 5,000 people are in hospital with the virus. We're being urged to mask up indoors and get a fourth jab. But we have another weapon and pharmacists want to sell it over the counter.
Cases are surging, our hospitals are heaving and the COVID-19 superdrugs are on the shelves.
They will have a dramatic effect on hospitalisation numbers.
But why are they so hard to get?
The time is ticking. Delays can have consequences.
Should we be popping these things like Panadol? Absolutely not.
They're called COVID antiviral drugs. You need to take them as soon as you get the virus or they won't work. And already over 70,000 of our most vulnerable Aussies have swallowed them. We met father of three, Robin, at the chemist.
She's had a liver transplant since 13 months old, and she's got some liver restrictions on her bile ducts currently, so she's been going in and out of hospital.
His vaccinated daughter, Angela, just 22, caught COVID, and it was her doctors at the hospital who went hunting for antivirals.
So the first 2 doses she had of the tablets, she was actually vomiting afterwards. Since first day, it actually, instead of the COVID symptoms actually increasing, it actually stopped them and started decreasing drastically downwards.
Hey Angela, Nat Wallace here from A Current Affair. How are you? You sound great.
Well, I just finished it yesterday. I feel practically back to normal now. I still do feel a bit lethargic though.
Well, that's good news, yeah?
Yeah, not going to hospital was honestly just the aim that I wanted to achieve, and I seem to have achieved it.
But getting these drugs hasn't been smooth for everyone. Hamdi Kadari from Your Discount Chemist at Greenacre in Sydney Southwest.
It does have to be taken within the first 5 days, and sometimes symptoms may arise. People might just sit on the symptoms for a little bit and then eventually do a test. A PCR might take a day for the results to get back. So it is a fine line.
This should not be about a turf war. This should be about putting patients first.
Anthony Tassoni from the Pharmacy Guild of Australia is fighting to let chemists hand out the drugs over the counter. Right now, patients need a PCR, a doctor's appointment and a prescription.
So overseas countries like New Zealand have recently allowed pharmacists to be able to supply these oral antiviral treatments for COVID-19 without a prescription from a medical practitioner. This is about patients. This is about getting them access to treatments in a timely fashion.
These aren't trivial medications to pop like Panadol. They are ones where we need to see a prescription that has been thought through.
Dr. Michael Bonning from the Australian Medical Association.
We want to see them remain a prescription-only medication.
He says the drugs are not for everyone.
We're balancing risk of very serious illness versus risk of side effects. We do not recommend these medications in people who are pregnant, and we also say that for people who are planning to get pregnant, that they should defer trying to get pregnant for a period of time afterwards. We know that in younger people we also see all kinds of other side effects, so gastrointestinal, muscle weakness. Some people are at risk of hepatitis.
And they also clash with a range of other medications. But is cost to the government also curtailing a larger rollout, even though our hospitals are under the pump?
Right now, only a few people are eligible to get their hands on these drugs. With the government's blessing, $6.80 concession a box or $40 for others. But without the help of the PBS, $1,000 a box.
Most pharmacies can't afford to have that kind of stock just sitting on the shelf. So they would probably just wait for a script to come in and then just say, look, we have to order it in and it'll come in the next day.
Which could be too late. To get a prescription, you need to be 70 and over and have COVID. If you're 50 and over, you need to have 2 risk factors. Anyone over 18 who is immunocompromised can also get a prescription.
Now that you've seen how well this works, would you want it yourself?
Look, yes.
Dad Robin doesn't qualify despite living in a house with 2 people who do. He's seen the state of our hospitals firsthand.
Would you like to see the government expand the eligibility criteria?
Of course. Look, anything that helps, why not?
But he says if it does expand, doctors and chemists need to be working together.
If you have a good family doctor that knows your history and knows these things and a good chemist, then yes, that's an option to have.